chairperson will make some remarks. There comes an item on the presentation by the content advisor on statutory rape. We consider and adopt a strat plan. There comes a consideration and adoption of minutes. There comes an item on the discussion on voting rights of alternate parties, alternate members from smaller parties. Then there comes the closing remarks by the chairperson. Honorable members, is there anyone who would like to confirm or say something on the agenda before I introduce a member that has joined us? Honorable members, assist me in...
Chair, I know you're struggling with the hands.
Yes, I do. I note you, Honorable Fitsane.
Thank you, Chair. Good morning to yourself, honorable members and parliamentary staff. I move for adoption of the agenda, Chair. Thank you.
Thank you, Honorable Shabangu. Any other member that would like to second or have a different view from Honorable Shabangu? I note hands.
Thanks, Chair.
Yes, Honorable Mtubazi.
No, thanks very much, Chair, and great members on the platform. I wanted to suggest, Chair, that item number 10 doesn't have numbers, but is on the discussion on the election. Smaller parties. I think it's item number 10. I wanted to suggest that we move that item to before the election of the chairperson. I think it will make sense that we discuss that issue before we get into the election of the chairperson. Thanks. But over and above, then I move if the members agree.
Any takes on the suggested item to be shifted up the agenda? There's a hand up if it's not a legacy hand.
Good morning. Thank you, Chair. Mr. Mchadu's hand is up.
Honorable Mchadu, the platform is yours.
Morning, Chair and honorable members. I second Honorable Pat. Let us start with that item. Thank you very much.
If there is no different view from what has been suggested, honorable members, where do you think we can locate the item? Can you assist on your side, Ms. Majalamba?
Yeah, no, Chair. I was suggesting that we just move it just before the election and everything can flow as it is. Thanks, Chair.
Noted, Honorable Mtubaze. Honorable members, let me take this opportunity to introduce to you the member that has joined the Portfolio Committee on Health, who is Honorable Faith Mtambi. Honorable Faith Mtambi is replacing Honorable, my apologies, is replacing Dr. Dlomo in the Portfolio Committee. So we've been joined by that member from the African National Congress. We have Honorable Mtambi now. Welcome, Honorable Mtambi, to the Portfolio Committee on Health. But it will be wise if you can greet the Portfolio Committee members and show your face just for a second. Honorable Mtambi, can we see you?
Thank you, Chairperson, and thanks for the warm welcome. I'm currently at the Magistrate Commission, if you won't mind my background, but I'm here. I'm also looking forward to working with all of you, and thanks so much for the warm welcome. Thank you, Chair.
Thank you very much, Honorable Mtambi. That was Honorable Mtambi, honorable members who has joined us in this portfolio committee. Can we move to the item that seeks to confirm attendance to the meeting and also talk on apologies? Ms. Machalamba?
Thank you, Chair. Present is Ms. Kleko, Ms. Shabangu, Ms. Tsine, Ms. Mutambi, Ms. Kumalo, Ms. Clark, Dr. Leroux, Mr. Mutubadzi, Mr. Taibosh, Mr. Mjadu, Ms. Chirompungose, Mr. Van Staden, and Ms. Mhlongo. I've received an apology from Mr. Zungula. Thank you, Chair.
Thank you very much, Ms. Majalamba. Those are the members that have joined our meeting. Remember, members, that this meeting will be conducted according to the National Assembly rules. Also, the procedures of a virtual meeting will bind us all in the meeting. That we have to see you at your start of your talking when you are recognized by the chair, and also that when you are unable to turn on your video, you must tell the meeting so that we allow you to conduct yourself as such. But the rules of the National Assembly will be binding us in this meeting. We have an agenda in front of us, honorable members, that we have adopted. I think we must go to that item which talks on the discussions on voting rights of alternate members. I will,
my hand was up. If I could just have the floor for a minute.
yes, Honorable Clerk, I give you my apologies for not identifying your hand, but now the platform is yours, Honorable Clerk.
Thank you, Chair. Thank you very much. I just want to notify you that I need to be at another meeting at 11:30 because this meeting wasn't on our calendar. So unfortunately, I had another meeting as well that I need to attend to. So I'm going to have to leave at about 11:15 to attend that meeting. Thank you.
Noted, Honorable Clerk, that apology is accepted.
Dr. Litlape's hand is up, Chair, also.
Dr. Litlape, I note you.
Thank you, Chair. I note that we finish at 12. I just wanted to alert members that I'll have a hard stop at 12 because of the gender-based violence activities that have to start promptly at 12. Thank you, Chair.
Noted, Honorable Letlape. Can you, Ms. Majalamba, have that letter that was written to you as a response to what was required by honorable members in the previous meetings, when we were discussing the issue on voting rights? Can you read it for the members or just flight it if you have it on your side so that the honorable members can have comments, those that would like to comment on it? There you are, honorable members. We deposited this to our WhatsApp group for you to read overnight. I think it was deposited in your emails some time ago, and last night Ms. Majalamba deposited it in the WhatsApp group of the portfolio committee. There it is. If there is any member that would like to comment on what is suggested there, I give time to that honorable member. We will note hands.
Dr. Leroux's hand is up, Chair.
I give you, Dr. Leroux.
Thank you very much, Chair, and thank you for that, giving that opinion as we had requested. I just wanted to make sure that we practically understand what this means. But from my understanding of this letter, the smaller parties will appoint an alternative member, and that alternative member at this stage is Honourable Zungula. And so I would understand that if a member of the smaller parties is not able to vote or is away or is recused, then it would be, I just want to get the practical understanding, is it would be Advocate Zungula, Honourable Zungula, who would be the alternative member in this committee, just for practical and purposes. Thank you very much.
Thank you, Dr. Leroux. Any other member that would like to have a take on the matter? Was that the only
Mr.
hand?
Mutabatse's hand is up, Chair.
Yes, Miss Honorable Mutabatse, I note you.
No, thanks very much. I think that lays our issue to rest, because the issue was whether he will be allowed to vote. I think that was the contentious issue. So my understanding is that if he's appointed as the one representing smaller parties, therefore when it comes to voting time, he will then be able to vote, because alternatively, if the main member is not there, say for example from the ANC or from the MK party, therefore the member who's been appointed as the alternate member and confirmed that he'll be attending, he will then have those rights upon his shoulders to can cast a vote. Thanks, Chair.
Yes, honorable members, but let me also.
Yo, Ndenzel. Sorry. I muted the chair. Chair, I muted you by mistake. I was. I accidentally muted the chair, so I'm
Oh
trying to
yes,
get to.
oh yes, oh
Okay.
yes. I recognize now that I'm back. I was saying, honorable members, that has also its own process that includes informing the Speaker of the National Assembly that so and so will be having voting rights because of that and that, as the letter is stating. What was flighted here includes that process. So you have to take care. I'm glad that how Honorable Tubatse puts it, to say it's not only for the member that was raised by Honorable Dr. Leroux, any member in the portfolio committee, any party, but that ends up with a process of informing the Speaker before that action happens. We have the same understanding around the matter. This is what Mr. Caso is explaining to us. It's written, deposited to you, and I think it's also our understanding in the meeting now. Can we proceed then to the next item? The agenda has been adopted. Me also, we considered the attendance and the apologies. Now we are going to come to the process of electing the chairperson of the portfolio committee. Honorable members. Yes, Honorable Mtubatse.
Yeah, no, thanks, Chair. I'm just laughing now that because we are confronted by this situation now, Honorable Zungula is not present. We are entering into voting. Practically, what happens now, is it the smaller parties who will inform us now who will be now taking over the space, or what happens, I might actually be blank around that particular issue. But if we can be assisted on the practicality of what is confronting us now. Thanks, Chair.
But Honorable Mutubatse, what is written is clear, and we tried to make you understand. But let me give it to Vuyokazi Machalamba to explain further. Over to you, Ms. Machalamba.
Good morning and thank you, Chair. The simple explanation is that any member who becomes the member of the committee, be it a full-time member or an alternate, must be published in the ATC. So Mr. Zungula also must be published in the ATC that he is going to be the alternate member for the small parties. So we'll be guided by the ATC. Thank you.
That's correct.
Thank you, honorable members. Thank you for that clarity, Ms. Machalamba. We now understand. Can we proceed? If we proceed, honorable members, to the next item of electing the chairperson of the portfolio committee. I would first want to
Dr. Leroux,
appreciate-
sorry, Chair. Sorry.
Come
Dr.
on,
Leroux's
man.
hand is up.
Yes, Dr. Leroux, can you come?
Thank you, Chair. Just, Chair, I hear what Mr. Majalamba is saying. I just, in terms of the practicality today, the smallest party's first member is here in Dr. Letlape, if I understand it correctly. So, Dr. Honorable Zungula's absence doesn't affect the vote that we take today, if I understand it correctly.
Yes, you are correct, Dr. Leroux. Let's go to the voting process. The person
Chairperson,
who's
my
going
hand's
to...
up.
Yes, Honorable Clerk, can you wait for me to finish to
Thank
say
you.
the person who's going to conduct elections will first introduce you to the process she or he is going to follow before conducting the very elections. I wanted to clarify that. I give it to you, Honorable Clerk.
Chairperson, my understanding is this is around minority parties. Action SA is not a minority party. So, automatically has a vote because he's a permanent member of this committee. They're not part of the minority parties. Member Zungula is part of the minority parties. And as you say correctly, he's got to be 80c'd in order to attend the committee. And then he has automatically voting rights. And that's how it works. Thank you.
Thank you, Honorable Clerk. That was also my understanding. Thank you very much. Let me take this opportunity, honorable members, to thank you for affording me the opportunity to hold the fort up to this far. We are now on the item of electing the chairperson of the portfolio committee. It is then that I will give over to Ms. Machalamba to conduct those elections. Over to you, Ms. Machalamba.
Good morning and thank you, Chair. According to Rule 158 of the National Assembly rules, a committee must elect one of its members as the chairperson of the committee. I will therefore call for nominations. I'll recognize hands, members.
My hand is up, Ms. Machalamba.
Ms. Kego?
Yes, thank you very much, Ms. Machalamba. I am nominating the name of Honorable Faith Mutambi to be the chairperson of the Portfolio Committee on Health. Thank you.
Thank you, Ms. Kego. Ms. Shabangu, your hand is up also. Are you seconding?
Yes, Ms. Machalamba, I'm seconding the name of Honorable Faith Mutamba. Thank you.
Thank you, Ms. Shabangu. Are there any objections? Are there any further nominations? Mr. Mutubatse's hand was up. Have you withdrawn? Mr. Mutubatse?
Yeah, no, I've withdrawn. I wanted to come before Mrs. Shabangu. She overtook me.
Oh, sorry about that. Ms. Kleko? Ms. Kleko?
Miss Majalamba, I think that's a legacy hand.
Oh, sorry.
My apologies.
Mr. Mchadu? Your hand was up.
I was seconding the name.
Oh, thank you. There are no further nominations and there are no objections. Ms. Mutambi has been elected as the chairperson of the Portfolio Committee on Health. Congratulations, Ms. Mutambi. I'm handing over the meeting to you. Thank you.
There's a hand that is up again of Honorable Mutubatse.
No, thanks very much, Chairperson. We want to take this opportunity as the MK Party to welcome you as the chairperson of the Portfolio Committee and impress upon you that we will support all the work that we do in this Portfolio Committee and further implore upon you that you must actually do everything in your power to make sure that you take us in as your children and guide us not into temptation. So we welcome you and wish you all the best in your new role as the chairperson of the Portfolio Committee. Thanks very much.
Thanks so much for the warm, kind words. Honorable Clark.
Thank you, Chairperson. I'm from the Democratic Alliance. I would really like to congratulate you and wish you all the best in your role as our new Chairperson. And we've known each other for many years, and I'm sure you will do justice to this portfolio, and we're all looking forward to working with you. Thank you very much.
Thank you so much for the warm words. I should think in the absence of any other Honorable Dr. Lekape.
Thank you, Chair. From Action SA, we'd just like to congratulate you, Chair.
There's a noise that is coming. Don't know where is it coming from. Okay, Dr. Liklape, I'm so sorry for the interference.
No, that's fine,
Yeah.
Chair.
Okay.
Just wanted to congratulate you on your appointment and that we wish you well. And as Action SA, we will work together with you and the rest of the team. Congratulations.
Okay. Thank you so much. This is so humbling. Honorable Van Staden?
Majalamba, please note me.
No, yes, we'll note you. Honorable Mhlongo, you'll follow
Thanks.
Honorable Van Staden.
Well, thank you, Madam Chairperson. No, I just want to wish you the best in your position as Chairperson of this committee, and we're looking forward to working with you for when you into the rest of the term. Thank you very much.
Thank you so much, Honorable Van Staden. Honorable Mhlongo?
Thanks, Vuyo. Would like to welcome and ensure that we will be working hand in hand with our newly elected chairperson. Good luck, Sisi. Welcome home.
From seat 1.
Okay, there's somebody's microphone that has got a background, but I think it was Honorable Mhlongo. Now that she is muted, we are fine. Dear colleagues, thank you so much for the humbling, warm welcome. I think I want to express my humble appreciation, and I feel honored and humbled to be able to serve with this dynamic team of professionals and colleagues. And I think I received this warm welcome with humility, and I can assure you that I take this responsibility with determination and commitment to work collectively. I'm personally a team builder so that we realize the aspiration of the equitable and quality healthcare for all in our country. I also want to thank the acting chair. She has managed with distinction to steer the ship and keep this collective to work together. And I know I'm stepping into huge boots, but I still think I will be able to navigate like my predecessor and the acting chair has done. And then I should think it's important that one affirms the imperative for the committee to champion the constitutional right to access to quality healthcare and to ensure that our legislation and oversight improve the health outcomes of the ordinary South Africans. There's a huge task amongst us to make sure that the national health insurance, the universal access of the health system must reach each and every individual South African, especially the most rural poor, the most vulnerable that depend in our healthcare system. And I should believe I'm coming in when you're also going to adopt the strategic plan that also shares the roadmap on our commitment to that effect. And I should think that with you holding each other's hand, we are going to make South Africa a better place in the sense of that as we hold the executive accountable, as we monitor the implementation of the health reforms, we'll do so, we'll be safeguarding the rights and well-being of our citizens. So ours as a team, we need to then have all this constructive debate as we do, and then we'll also be drawing on the diverse expertise of all of you. And then as we collaborate with each other, I should think, including the department and all the stakeholders in the portfolio, in the sector, will be able to do more together. But I should think that all of us will know the task before us is so immense, but collectively we can make a meaningful and lasting impact, especially when we are also blessed with a team of professionals whom will always bank on their wisdom, including all of you who are here. I think we have the creme la the best, and I think together we can do more. I'm so humbled. It's quite an humbling experience for me to serve amongst this team, dynamic team that is dedicated towards the fulfillment of the well-being of all our citizens. I want to thank you for the confidence, and I will say I dare not disappoint, and I'm happy to be part of this PC Health family. Thank you so much once more, colleagues, for the warm welcome. And having said that, I should think then I need to take over the agenda, ask the committee secretary to fly the agenda as proposed so that we proceed with the next item. Thank you so much, colleagues. We are then on item that was supposed to be presented on 10/25. Is the presentation by the content advisor on the statutory rape report. Over to you, content advisor.
Thank you, Chair. Good morning to you, Chair, to the honorable members and colleagues and everyone present in the call. My name is Lindo Ngomane. I'm the content advisor supporting the committee. I would just share the reports that I'll be presenting, Chair.
I presume everyone got the report. It's disappeared on the screen.
I'm gonna load it now, Chair. Thank you. Thank you, Chair. Once again, this is the report of the Portfolio Committee on the stakeholder engagement that the committee held on the statutory rape referral. The report entails a brief background on what transpired, the stakeholders that were engaged, their presentations, the key issues that emerged, and the two key stakeholders were the South African Medical Research Council and the National Department of Health. And then we'll have the committee observations and the committee recommendations. The Portfolio Committee on Health is part of a referral from the National Assembly tasked to assess the scale, drivers, and national response to statutory rape. The committee engaged stakeholders, key stakeholders on the matter, and these were the South African Medical Research Council and the National Department of Health on the 11th of November. The purpose of the engagement basically was to understand the prevalence and the health impacts of statutory rape, evaluate service delivery readiness and reporting systems, and also identify the gaps and strengthen intersectoral responses, and also come up with recommendation in regard to statutory rape. On the key messages from the presentation of the SMRC, they presented on the prevalence of statutory rape and actually stated that statutory rape and child sexual abuse remain pervasive and significantly underreported. Many survivors do not disclose due to stigma and harmful social norms. Boys, in particular, disclose the least. In terms of evidence on health impact, the SMRC reported that child sexual abuse is linked to lifelong mental health issues, chronic illnesses, and increased HIV vulnerability. They also reported that research shows that there are strong links between early trauma and later risk behaviors. In terms of the data and statistics that they presented the study called the Bed to 30, which shows a sharp rise in sexual violence in adolescents and high polyvictimization. They also presented on the Optima study, which shows that 11 to 16% prevalence of sexual abuse among 15 to 17-year-olds and low seeking help behavior. They've also presented on the rape adjudication study, which they called the REPSA, and noted that nearly half of rape victims are children and conviction rates are low. They also presented on the rape impact cohort evaluation study, which they call the RISE study, and actually noted that childhood sexual abuse increases risk of adult hypertension by 64%. They also talked to other intervention and behavioral studies and said that the studies illustrate lifelong emotional, physical, and social consequences. In terms of the challenges that were identified by the SMRC, there is underreporting driven by stigma, fear, and mandatory reporting complexities. There's also ethical constraints in child abuse research and fragmented data systems across health, justice, and social services. In terms of the interventions that were proposed by the SMRC, this includes the linking of administrative data systems across the different sectors. There's a need to improve survivor access to mental health and psychosocial services, There's a need to scale up evidence-based prevention programs and ensure long-term investment which are aligned to national frameworks. Coming to the key messages from the National Department of Health, the department reported on the service delivery gaps and reporting that there's uneven compliance with mandatory reporting across health facilities. Also, designated hospitals and the Tutuzela care centers face staffing shortages and resource constraints. In terms of statistics, the department reported that the number of young or minors that gave birth declined from 3,870 in 2019-20 to 2,387 in 2024, but noted that the number remains high. Deliveries among the teenagers 15 to 19 dropped from 127,000 to 114, just over 114 over the same period, reflecting only a modest decline. The department noted the major discrepancy between minor pregnancies and the Form 22 or SAPS reports and stated that there is clear evidence of systematic underreporting. They also noted that there are weak data system between the relevant departments, the National Department of Health, DSD, SAPS, and meaning that pregnancy-related statutory rape cases are often not documented or investigated or followed up. The department spoke to the legislative and policy framework and mentioned the criminal law, which is the Sexual Offences and Related Matters Amendment Act of 2007, and the Children's Act, in particular Section 110, the Choice of Termination of Pregnancy Act, which provides for termination in cases of rape or incest or for social and economic circumstances. In terms of service delivery, the department mentioned that there are quite a number of operational responsibilities. They are responsible for a number of operational responsibilities, including the provision of clinical care, which includes the treatment of injuries, provision of PEP for HIV, STI management, contraceptives, and pregnancy prevention. They mentioned that there are 243 designated facilities across the country that provides a full package of post-sexual assault services. And there's forensic evidence collection and documentation for legal processes, crisis counseling and mental health screening, mandatory reporting through the Form 22 and referral to DSD and SEPS. They provide capacity building for clinicians on guidelines and legal obligations. On intersectoral collaboration, the department highlighted the importance of collaborating in addressing this issue. They spoke to the issue of strengthening the school health program by providing age-appropriate sexuality education and reporting protocols, childcare and protection forums, which is led by the DSD, the expansion of the Tutuzela care, the need for the expansion of the Tutuzela care centers, which currently sits at 66 centers at the moment. And then they also emphasize the collaboration with SAPS, NPA, DBE, Department of Basic Education, Department of Social Development, NGOs, and other UN partners to strengthen the prevention, reporting, and survivor support. They also spoke to the challenges which involves the non-availability of 24-hour services and the need to expand the Tutuzela care centers. Health worker capacity is limited and targeted training needs to be strengthened. Community engagement remains weak, making outreach programs vital to raise awareness about statutory rape, consent, and available resources. The lack of safe spaces for the youth, there's a need to roll out the youth zones, and they spoke to the data accuracy, which is inconsistent, and disaggregating age cohorts in the DHIS system and reinforcing the mandatory reporting. In terms of the proposed intervention, they spoke to the expansion of prevention and community education, the need to strengthen early prevention intervention through the school-based health education, collaboration with NGOs, faith-based leaders and community structures, support the Department of Basic Education protocols in managing and reporting abuse in schools. Then there's strengthening of mandatory reporting compliance. They spoke to the need to enhance the training of healthcare workers on statutory reporting duties under Section 110 of the Children's Act, improving the monitoring mechanisms to ensure that these forms are captured and submitted as required. And also the need to develop a user-friendly reporting tools or formats to reduce the delays in submitting these forms. Strengthening the support of support services, which includes the expansion of the Tutuzela care centers and ensuring that it's adequately staffed, improving the integration between these centers and SEPs and courts to reduce the case attrition and improve conviction outcomes. And they also spoke to the need to improve the data and case monitoring systems, which is the strengthening of the health information system, integration of the data systems from the DSDs and SEP systems, and the verification thereof, and introducing a reporting cycle to Parliament on trends and gaps and outcomes, so that Parliament also keep track of the work that's been done in the provinces. The need to enhance the intersectoral coordination. There's a need to have joint protocols between the different relevant departments, and establish a response task team to monitor the implementation of these protocols. In terms of the committee observations, the committee highlighted the need for age disaggregated data aligned with the legal definition of statutory rape, expressed concern that only 10% of reported cases result in convictions. The committee was not clear about the adequacy and accessibility of mental health services for survivors, whether there is and whether it is adequate. They also inquired about strategies to address the persistent underreporting in health facilities and school settings. Question how research data can better inform and strengthen its oversight and response mechanisms within the sector. Highlighted the importance of collaboration with traditional leaders, particularly in rural areas, to improve data collection efforts. Inquired about the underlying causal factors such as alcohol and substance abuse and the interventions in place to address these drivers. The committee noted the inadequate collaboration among the relevant department and sought clarity on how the health sector engages with those sectors to address the gaps and weaknesses. Committee flagged gaps in mandatory reporting practices and requested further information on the barriers that hinder effective reporting. The committee observed that there's a deficiency in training and capacity building for staff on mandatory reporting obligation, and requested details from the provinces and which provinces received the training, the hospitals and the clinics where the training was conducted. Concern cultural norms that perpetuate harmful practices, and ask whether engagement on these issues are underway. the committee inquired about the standardized protocol for reporting statutory rape across the provinces and whether health professionals are aware of and to ensure seamless reporting. The accessibility to Tuzela centers, particularly in rural areas, was raised by the committee and regarding, in particular, regarding transportation challenges faced by victims. Based on these presentations and the committee observations, the committee made the following recommendations. On data quality reporting and use, the committee recommends that there should be standardized data collection tools across all provinces to ensure uniform age disaggregation aligned with legal definitions of statutory rape. There's a need to strengthen the collaboration between health, justice, basic education, and social development to create an integrated statutory rape data dashboard, because currently there seem to be each department working in silos. So there's a need for these departments to come together and have a database that will be accessed by all the relevant departments. Conduct a joint health subs justice review to identify the bottlenecks in case progression, including evidence collection, case handover, and medical documentation. Enhance the medical legal training for clinicians to improve quality of evidence to support prosecutorial outcomes. There's a need to formalize a mechanism for translating research finding into policy recommendations, pilot the interventions and targeted oversight focus areas. There's a need to establish community-level reporting channels in partnership with traditional authorities to improve surveillance and referral pathways. There's a need to integrate community education campaigns with local leadership structures to support accurate case reporting. On strengthening the health sector support for survivors, there's a need to expand the access to mental health services by increasing the availability of social workers, psychologists, lay counselors at primary healthcare level. Ensure every facility handling sexual assault integrates a defined mental health referral pathway within the 72 hours of presentation. Improve access to the Tuzela care centers in rural areas, and strengthening the transport arrangements for the victims. On mandatory reporting and addressing underreporting, there's a need to strengthen the school clinic reporting linkages, including the designated mandatory reporting focal person at each facility. Implement community-based awareness programs on reporting rights and obligation. Conduct a national audit on mandatory reporting compliance to identify procedural and training-related barriers. Update and reissue guidelines clarifying reporting obligations, response timelines, and escalation pathways. Mandate annual refresher training for health professionals responsible for handling and initiating the reporting of statutory rape cases. Ensure that all facilities display user-friendly flowchart outlining reporting steps, responsible persons, and contact points. On the prevention and addressing drivers of statutory rape, there's a need to strengthen intersectoral prevention program addressing substance abuse, unsafe environments, and adolescent vulnerability. Scale up community-based harm reduction, parenting support, and adolescent behavior change intervention. Partner with traditional and faith-based leaders to address harmful gender norms, stigma, and silence around sexual violence. And lastly, the interdepartmental coordination. There's a need to introduce joint performance indicators for the relevant department, which is health, subs, basic education, social development, and justice, to ensure accountability for case management, prevention, and reporting. That's the end of the report, Chair. Thank you.
Thank you so much, Ms. Ngomane, for the report. Are there any additional inputs from colleagues? I'll see it by show of hands. Yes, I will start with you, Honorable Clerk. Then you'll be followed by Honorable Mtuwase. Then Dr. Litlape will follow. Those are the three hands thus far. And then Honorable Shira will also follow in that order.
Thank you, Chairperson. There's just one aspect, and it's more a comment, is the Tutuzela centers. So I have visited many of those Tutuzela centers, and some of them are very well run, but others are extremely under-resourced. But there is an issue that Tutuzela care centers have to find some kind of synergy with the local clinics and the police stations in the area where they are based, because that is not happening. And it's really important in terms of dealing with GBV and statutory rape in our country, that these three facilities actually work together in synergy. Because I've seen, for instance, in Davidson, where there's a big Tutuzela care center, that victims come to the Tutuzela care center, the clinic's right next door, they do not talk to each other, and the police station is right across the road. So that is something that really has to be strengthened, is those three facilities need to strengthen relationships. Thank you very much.
That's a fair input. Avoid silos. I think that can be consolidated. Honorable Mtuwase.
No, thanks, Chair. I welcome the report as consolidated, but also to find out, because we are left with the 30th, to have a consolidated report with other portfolio committees. When are we going to have a consolidated report? Will it be presented to us so that as a committee we are satisfied that it has inserted all the recommendations that we are making as a committee? But also, just to say that on our part, as a health, we need to impress upon the department, in particular around the training of our staff. That's the work that we must do to make sure that at the start, they understand what is expected in terms of the legislation. And that's the point that I want to emphasize, that we need to impress upon the department to fast track that particular area. If needs be, if there's any need for budget that would come, I will implore the department to come back to us so that they get the necessary support, because this is a serious matter that is confronting society. Thanks, Chairperson.
Thank you so much, Honorable Mtuwase. Dr. Litlape.
Thank you, Chair, and thanks for the report. The part for me that is a bit of a problem is the realization that what we have is not working, and we now frantically wanting to do more on something that doesn't work. There's been thoughts that have come through about the need for the Law Commission to review all the laws so that we have a complete rethink. Because what has clearly come out is that what we have is confusion between things that are community-based and criminalizing them. So I'm not too sure when we're going to have that opportunity to talk about the review of the laws, engagement of the communities, and rewriting this aspect of our legislation, and stop legalizing things that should be left to communities to deal with. Instead, we must just support the communities. Thank you, Chair.
Okay. Honorable Shira.
Thank you, Chairperson, for the opportunity. Ngibulise to all the members in the meeting and the staff members as well. Chairperson, bengicela ukuthi si include, we've made this deliberation. I'm not sure if it was in the joint sitting, but it is in the other reports. Women, youth, and persons with disabilities. I think we should also add it to our part, because we made that contribution there as well, so that there's synergy as well. Number one is that social development must increase personnel in the form of social workers that are stationed in hospitals and in schools, particularly for this matter. And number two, that there be a national reporting, a cohesive system nationally that includes provincial leaders of different portfolios in the executive and parliament members on a voluntary basis that will do term-based reports to parliament on a continuous basis until we get somewhere in resolving inkinga statutory rape. And then thirdly, that we devise a system collaboratively, not just as parliament or the involved portfolio committees, but even in the provinces, that is mainstreamed, that simplifies reporting. It must be just as easy to report ukuthi ingane ikhulelwe esibhedlela or is doing a termination of pregnancy, just as it is easy to report a gun wound and it's taken up by SAPS on an urgent basis. Yes, Hlalo ngiyabonga. Ithuba ngiyabonga too. Thank you.
Thank you so much, Honorable Shira. Dr. Kla, Dr. Leroux.
Thank you very much, Chair. Yeah, thank you for that report. I think that I'd like to echo the sentiments of my honourable colleague around the salarification, and I think the issue there is well, maybe I should start off with saying I think one of the things I don't see in the report is I do think that they have spoken about protocols and about training, but I think that there have to be very clear protocols that probably come from the National Department of Health about how we do this and how we deal with episodes of statutory rape. And I think that particularly in the Department of Health, because we come across, I know there's a lot of statutory rape that happens that we are not aware about, but I think that what we within the Department of Health come across children who are pregnant or who and sometimes children who are requesting to have contraceptives, and I think in both those cases it obviously needs to be handled sensitively and thoughtfully, and we do not want to criminalize normal experimentation and sexual behavior between the same age children, for example, to 15-year-olds, but we also do need to investigate each of those cases very carefully. And so I think that the first thing I want to say is that we do need to have a proper protocols that say who is responsible for that investigation. Is this a relationship between a 13-year-old and a 25-year-old, or is this a relationship between two 14-year-olds? And I think that that's the first thing to say. The second thing to say is that we do, when we have a pregnancy or a baby being born, we have DNA evidence that cannot be erased, and a lot of the problem with prosecution is that DNA evidence that we can get is often found too late or is of poor quality. But of course, with the child available, we can just do a buccal swab and we can then identify whether the alleged perpetrator, the 25-year-old man, is actually the father of this 12-year-old girl's child, and we can then act on that. And I think that we do need to have, therefore, make sure that we have a very close working together between social workers, hospitals, and the police in this way, and that those cases where we have clear wrongdoing and we have the clear evidence that we actually have a concerted effort to go after these perpetrators, because we need to show from the government side that this kind of behavior is unacceptable. And I think that for me isn't quite it's in general terms spoken, but I think we need to have very practical, clear protocols that allow for that kind of consequence approach, particularly where there's a big gap between the pregnant girl and the father. Thank you very much.
Yes, it's noted, and thanks for the input. Honorable Van Staden.
Thank you, Chairperson. I just want to put my voice together with Member Chirwa and what Dr. Leroux have just said. I think we need to work together with the Department of Social Development and the Portfolio Committee on Social Development on these matters. The reason why I'm saying this, it looks to me, and I don't want to say that is for a fact, but I'm reading the reports of the Portfolio Committee on Social Development, and it seems that they are struggling with a bit of how can you say, the work that must be done on ground level. Excuse me, on ground level. I've made some previous statements on social development debates this past year in Parliament, and what worries me that I think it was the first or the second debate which was done last year in the vicinity of June and July. When I raised certain matters about problems in some provinces, on these matters we're discussing now, the minister replied in a debate to me, but they are only a national department. Now, that's a bit problematic for me because we see a lot of problems in the different provincial departments. So my sentiment is that we as a committee need to work together with that committee, portfolio committee, on certain matters. And I think these matters are one of these matters that we can collaborate with them on it. That's just a suggestion for me, Chairperson. Thank you.
Yes, did I miss any other hands? I think what you were doing, colleague,
Yes,
was
you do,
just
Chair. My hand was up. Chairperson, my apologies.
Oh, you can shoot. Okay, thank you.
Thank you, Comrade. Thank you, Honorable Chairperson. I think, Chair, let me start by appreciating the declaration that has been made by the President of the country on the issue, around the issue of gender-based violence and femicide. My thinking is that that will lead to more resources allocated to the fight against gender-based violence and femicide. Also, I think of the stakeholders that were written to, because when we were following our stakeholders as portfolio committee, there were those that we did not get chance to invite, but were written to. I'm thinking of their recommendations. My advice would be that the content advisor looks at them when they arrive before the submission of our report to the coordinating portfolio committee. If there are any gaps that she can see on their submission, more so on the recommendations, I think she can lift that be shared with us, and also before the adoption by Parliament. I implore upon you, Chairperson, to advise the Chairperson of the coordinating committee, which is the Committee on Women, Youth, and People Living with Disabilities, to share with you. You also share with us the consolidated report before it is tabled to Parliament. Otherwise, I can safely say this may be our final report as the portfolio committee. It can be shared with that coordinating committee. But I wanted to advise the meeting that there were those that were still awaiting for them to submit. At this stage, we are interested in their recommendations, so that if there are any gaps that may be identified in our report, those gaps can be filled through, maybe through the submissions of those stakeholders that we have written to, those that have not yet responded. I wanted to advise on that, Chairperson. Otherwise, I accept the report. Thank you.
Thank you so much, colleagues. I don't think I've omitted any other colleague. Is that so? Can I hear a shout for those who cannot raise their hands on the system? The silence, it means that everyone is covered. I should think all these comments by colleagues are very critical. The issue on the consolidated report definitely will liaise with the chair on the portfolio committee on women so that before it's finalized, it's shared with us also so that we then comment and make our input. There's an issue of the budget that Honorable Motovatse raised. I think it's well captured as well. Totally, Kape, you have raised a critical issue with regard to the review of legislation and the engagement of the Law Reform Commission. I think this is the matter we must also raise and then make sure that we elevate it and then gets attended. We all know that statutory rape is a health issue. And then I should think with all this recommendation, I think these are the matters that we need to then put in our committee agenda in the next term so that we make sure all our recommendations are implemented to the letter. And I should think all these inputs, like the issue that Honorable Clegg has raised about the silos mentality, the silos that will happen, you find institutions seated together, not talking together. I think jointly with the relevant committee, the issue around joint portfolio committee meetings should also feature so that we make sure that our recommendation, once the report is adopted in the House, it's implemented to the latter. So we must make sure that all our recommendations then in terms of a monitoring progress and implementation, and with regard to the sponsoring of the review of the legislations, I think we should also, as this committee, lead the process. But I should think whatever has been raised by the colleague was to enhance the report, and we have noted that it shall therefore be incorporated in this report in line with what you have all contributed. Having said that, then I should think with all this input that is being made, can I put it to the House so that with all these other comments and inputs that you'll be, the document once revised, it's gonna be shared with you. I should think there's a unanimous support on the document unless there's any other contrary views. That might take. What I'm trying to say is just that can I then get a mover for the adoption of the report with all those amendments as members have raised, with the view that they are going to be consolidated, and then the report will be shared with you once all your comments have been consolidated. I'm seeing two hands. It's Honorable Mutuvatse, then Honorable Marcelo Sene. In that order.
No, thanks, Chair. I want to move, but also if we can get an indication of the refined final consultation with other committees as mandated by Parliament, because we have a date with Parliament to present the final report that is on the 30th. Thanks, Chair.
Okay, that is in order. Honorable Sene.
Thank you very much, Chairperson. I want to second Honorable Mutuvatse on the adoption of the report. Thank you, Chair.
Thank you so much, honorable members. Then that moves us to the report is so adopted with all those additions and comments. That moves us to the second item. Is the committee strategic plan? Honorable Sene, is it a legacy end or it's a new one?
My
Oh,
apologies, the legacy hand.
thank you. Thank you. Secretariat, assist us on the next item. I see the committee researcher. The item is on the screen. You can proceed.
Thank you, Chair. This is the 5-year strategic plan of the Portfolio Committee on Health. This is the forward by the previous chairperson. Just to mention, Chair, that this strategic plan was considered previously at a separate meeting. I'm sure it was in September or October, around that time. I'm not sure, but I don't have the exact date right now. The contents is the part A, which is the strategic overview, part B, the strategic objectives, part C, risk management, and part D, the resource allocation. This is just the ordinary vision and mission of Parliament, the values of Parliament, the mandate of Parliament, the legislative mandate, the policy mandate of which includes the National Development Plan Vision 2030, the Medium-Term Development Plan 2024 to 2029, which sets out government's health priorities for the 5-year cycle. Then we have the United Nations Sustainable Development Goals, which were adopted in 2015, which commits South Africa in advancing health and well-being through Goal 3, which is to ensure healthy lives and promote the well-being for all at all ages. And we have the African Union Agenda 2063, which is the long-term blueprint for inclusive growth and sustainable development in Africa. We have the International Health Regulations, the IRH 2005, which are legally binding instruments adopted by the WHO and 196 countries, including South Africa, which provides the global framework for prevention, detection, and responding to public health threats that may come across our borders. This is just the situational environment of the Portfolio Committee. It speaks to the institutional constraints, which requires the balancing between the demanding legislative agenda and intensive oversight responsibilities. The issues of legacy issues, which were carried forward from the 6th Parliament, which includes the Tobacco Products and Electronic Delivery Systems Control Bill, which was introduced in the 6th Parliament but not concluded, which this 7th Parliament is currently processing. Oversight during the 6th Parliament, the issues that were identified, which includes governance issues within the provincial departments, rising medical legal claims, accruals, systemic failures, and uneven enforcement of quality standards by the Office of Health Standards Compliance. Other legacy issues include the constrained fiscal environment for health, issues of the declining real-term allocation to the health sector and the shrinking budget and infrastructure backlogs were identified. Regulatory gaps and accountability concerns within the medical scheme sector were highlighted. Over the PC on health oversight in the 7th Parliament will prioritize the national health insurance readiness by ensuring that the department establishes the NHI fund and the governance structures in line with the law, strengthening governance and accountability by intensifying scrutiny of the provincial departments of health, the PC on health oversight in the 7th Parliament will prioritize the national health insurance readiness by ensuring that the department establishes the NHI fund and the governance structures in line with the law, strengthening governance and accountability by intensifying scrutiny of the provincial departments of health, quality of care and patient safety by monitoring compliance to the norms and standards set out by the OHSC and implementation of the Health Ombuds recommendations. The health financing sustainability, which includes the resource allocations by the department and the entities, ensuring that public funds are managed transparently and in line with the PFMA. Then we'll look at the human resources for health, where the committee will oversee the development and implementation of strategies for the recruitment, retention, training, and equitable distribution of healthcare professionals, and also monitor the compliance to HRH policies. On the strategic priorities, the strategic priorities for the 7 parliaments include the strengthening oversight, enhancing legislative processes and public involvement, improving public appointment processes, but that's a strategic objective specifically for Parliament, not for committee. Improve international participation, which includes the improvement in the ratification and monitoring of international agreements. Then the committee 5-year priorities. We have priority number 1, which is the strengthening oversight of the health sector. Here we'll ensure the monitoring of ensure effective monitoring of the health sector by assessing the building of hospitals and clinics, appointment of doctors and nurses, appointment of retired medical professionals to alleviate staff shortages, procurement of beds, medical equipment and medicines, the formal integration of indigenous medicines into healthcare, the prevalence of unregistered or fraudulent doctors, status of progress in the implementation of the health market inquiry recommendations, issues concerning substance abuse and mental health, systemic challenges of gender-based violence and femicide. The former chair has already spoken about this issue. Then we have the monitoring of the Department of Health in ensuring effective oversight through regular meetings and reporting on key performance metrics, which includes the backlog on medical procedures, backlogs in mortuaries, a functional health information system, challenges and progress within the department, budget needs, absence of institutional leadership in health facilities, targets that are not achieved and the reasons thereof. The monitoring of the entities, we have the Office of the Health Standards Compliance, that they need to report on the number and specific facilities inspected, the numbers of inspectors they have, and the strategies for training additional inspectors. The health ombud to report on the types of complaints received, as well as the facilities involved. The Mines and Work Compensation Fund progress report on delivering compensation to ex-mine workers. Then we have the provincial departments of health, which needs to appear before the committee and to account on issues of audit outcomes, irregular expenditure and accruals, underspending of budgets, unspent funds, non-payment of health professional, consequence management, operational challenges in health facilities. Then the committee would need to conduct oversight visits in Limpopo, Mpumalanga, Free State, Northern Cape, and the Western Cape, hold engagement with frontline clinicians to gather their insights. The committee would ensure effective monitoring of health facilities by ensuring that there are compliance and maintenance plans for infrastructure, functioning hospital boards, prevention and detection of corruption and related activities, and human rights violations. The committee plans to have regular cross-sectoral meetings. This will include the Department of Public Works and Infrastructure at national and provincial to address major infrastructure challenges at various health facilities and the issues of abandoned infrastructure projects, the Department of Basic Education to get an update on the immunization program for learners and placement of nurses in schools, the Department of Social Development to oversee and support drug rehabilitation centers. And it also came out at the previous discussion that this engagement should also include the issues of statutory rape, the Department of Transport to tackle alcohol misuse and improve road safety, the Department of Higher Education to ensure proper training and placement of medical students, the Department of Home Affairs to manage health implications related to illegal immigration, for instance, illegal foreigners accessing healthcare services, the Department of Science and Innovation to engage on indigenous knowledge and knowledge systems, National Treasury to ensure that the OHSC, Head Ombud, and SAPRA, this is our head entities, secure adequate budgets and to ensure the financial sustainability of the NHI. On priority number 2, which is advancing legislative and policy reform, the committee will monitor the alignment of legislation with national priorities and international obligations by conducting joint meetings with other committees on cross-cutting legislation and policies. The committee will finalize the pending legislation, which is the Tobacco Products and Electronic Delivery Systems Control Bill. The committee did convene a joint meeting with, not really a joint meeting, but a meeting with South African Police Service and the South African Revenue Service to discuss matters related to illicit trade of tobacco and related products. The committee will ensure that new laws and amendments promote equitable, sustainable, and effective health service delivery. It will monitor the implementation of enacted laws through oversight visits, departmental briefings, and stakeholder engagement. On priority number 3, which is promoting quality of care and patient safety, the committee will track the implementation of the OHSC standards and the Health Ombud recommendations. By holding quarterly briefings, convening special meetings where required. For instance, when the Head Ombud has released a major investigation report, the committee will promote initiatives that improve patient safety, clinical governance, and compliance with norms and standards. Here, the committee will monitor the proportion of facilities inspected and certified by the OHSC through their annual reporting. This does not mean that the committee will have to go to all the facilities, but this will be through the reports of the OHSC. The committee will request reporting on corrective actions for facilities that failed inspections, request briefing on the status of hospital boards and clinic committees to assess their functionality, monitor leadership and management capacity at facility level, request the progress report from the Council of Medical Schemes regarding the Section 59 investigation. On priority number 4, which is ensuring sustainable health financing and resource management, the committee will monitor the impact of medical legal claims on provincial department budgets and service delivery. The committee plans to convene a meeting with the South African Medical Malpractice Lawyers Association, request quarterly reports from provincial departments on the value of medical legal claims lodged, pending, and settled, request an update on the implementation of the case management system on medical legal, request reports on alternative dispute resolution mechanism being piloted to reduce costly litigation, engage the professional councils, the HPCSA and the Nursing Council on their role in reducing clinical negligence and through professional standards. The committee will oversee the strategies for human resources planning and the equitable distribution of resources by requesting annual workforce planning reports from the Department of Health, tracking training, retention, and placement initiatives, monitor the budget alignment with HR and service priorities. Priority number 5, which is enhance public participation and transparency. The committee will ensure compliance with public participation legislation by ensuring that it adheres to the legislation and policies governing public participation, which is includes Section 6, which is on receiving and public input, and Section 59, which mandates the NA to facilitate the sections of the Constitution. And then we also have section 6, 9, and 13 of the Public Participation Policy Framework, which also outlines the procedures for engaging the public in legislative and policy matters. Then we have priority number 6, which is monitoring emerging health challenges and risk. The committee will support initiatives that improve health system resilience and preparedness for future public health emergencies. This will be through the review and ensuring that national and provincial health policies incorporate emergency preparedness and resilience measures. The lessons from COVID-19 will be reviewed to guide continuous improvement. Priority number 7, which is strengthening international engagement. The committee will request the department to provide regular briefing to the committee on international matters, including international treaties, an update on ratification, implementation, and compliance, international meetings that the department attended, and such as international health agenda, international health regulations, any progress in that regard, and if the committee feels that there is a need to get the WHO Framework Convention on Tobacco Control, they can also invite the department or the WHO itself to present on that as they process the tobacco bill. On the last priority, which is priority number 8, in addressing legacy issues from the 6th Parliament, this committee will build continuity in oversight to ensure that previous recommendations are implemented and systemic weaknesses are addressed by maintaining a database of past recommendations and implementation status, request written reports and presentations from the department on corrective measures taken. On the strategic objectives of the committee, we have legislation, just to say that the outcomes will be to ensure that the legislation is aligned with NDP outcomes and it's processed timely, and all the legislative processes includes meaningful public participation, which the committee has done really well with the tobacco bill by visiting all 9 provinces and also having oral presentation in Parliament, virtual oral presentation in Parliament. We also receive over 40,000 written submissions on the bill. So public participation is high on the agenda of the committee. On oversight, the committee will ensure that the departmental performance is aligned with its strategic plans and objectives are met, the performance plans of the department, and that resources are budgets are allocated effectively and in line with approved programs. The improve accountability of provincial departments. The committee ensures to monitor the provincial departments more closely. Provincial oversight visits when the program of Parliament allows. Are spoken to public participation, that also that the committee will ensure transparent proceedings with its meeting, ensuring that the public can access their meetings and public communication through media statements and public announcements. Cooperative governance, the committee has already spoken to the issues of collaboration And also, I think it will come in where the committee would conduct joint oversight visits on international engagement and cooperation. The committee will ensure that it is active in international legislative bodies and strengthening collaboration and knowledge exchange. Ensure that international agreements are ratified when they come before the committee. Improve compliance with international agreements through regular monitoring and oversight of obligations undertaken by the country. Now we'll come to the breakdown of the strategic objectives and the indicators and targets. The strategic goal number 1, which is on the legislative process, the outcome is to ensure timely processes of legislation with improved adherence to parliamentary timelines for bills. At the current moment, which is the financial year 25-26, the committee has one bill. The baseline is also one bill, which the committee had in 2024-25. The department plans to bring 2 bills in the financial year 26-27, 3 in 27-28, 2 in 28-29, and 1 in 29-30. So yeah, the legislative program is very tight. There's so many bills that the department plans to bring to Parliament. Yeah, the percentage of bills processed within stipulated timelines, the process will have to be completed 100%. The number of public participation sessions held per bill, the baseline is 27 local municipalities that the committee visited. And this is subject to the bill under consideration. Probably some of the bills, it will depend on the committee on how many provinces or municipalities they would want to visit. And then in terms of the oral presentation, the committee spent 20 days on this for the NHI, and then also 20 days on the current bill. The plan was to spend 20 days, but I think it was even less than 20 days. On strengthening oversight and accountability, the number of engagements with the department entities and stakeholders, the 5-year baseline is 160. So we use that as a baseline. In 2024-25, there were 32 meetings, and then in 25-26, we plan that we would have 32, but it could be more, it could be less. This will be monitored as over the 5-year period. Quarterly expenditure reports, the committee needs to ensure that the department presents these reports on a quarterly basis. And then the alignment of departmental entities with strategic plans, this was achieved previously, and this needs to be monitored and ensure that it's 100% aligned. Quarterly performance compliance, this was achieved previously and would need to be monitored over the 5-year period. Achievement of targets, the previous financial year, it was 58.3, but this needs to increase to over 80%. That's 58.3 is low, it's very low. The department needs to pull up its socks in this regard. The number of provincial oversight visits conducted, previously it was 3 oversight visits, and then the plan is to have from the baseline 3 oversight visits per year. The number of facilities visited per oversight, 5 facilities from the previous financial year, and that was used as a baseline. The number of provincial departments performance briefings held. This is a new indicator. The committee has emphasized the need to have the provincial departments present to the committee, at least all of them in a year. The committee will have to plan that at least they see 2 to 3 provinces per quarter in order to achieve this. The performance of the percentage of recommendations implemented. This is also a new indicator. We'll have to monitor the implementation of the indicators by requesting the department to provide a report on the implementation of the recommendations. Strategic goal number 3, which is public participations. The committee does call for written submissions, so that's 100% compliance with the previous bill and this bill as well. The number of public hearings conducted, so it depends on the plan at the beginning, the public participation plan of the committee, where they would want to go and which provinces they would want to visit for public participation, ensuring that the committee meetings are open to the public. On strategic goal number 4, which is improve international engagement, a number of international forums or meetings attended. Previously, it was 1, the baseline is 1, so we maintain that the committee would ensure that they attend at least 1 international forum or meeting. The ratification of international agreements, it was 1 in the previous year, and this will be determined by the arguments referred to the committee. In terms of risk management, the committee has identified that there are oversight coverage gaps due to limited site visits and joint oversight. The committee plans to conduct joint oversight with other committees and also use technology for virtual oversight to broaden the reach, because sometimes the parliamentary program doesn't allow for the committee to visit as many provinces as they wish. The non-alignment of NA and NSOP programs, this needs to be coordinated with the select committee. Institutional capacity constraints, the committee will need to advocate for increased resources to deal with the legislative workloads. I've already mentioned that the committee receives a huge number of public submissions, and that was also the case with the NHI. So the health committee receives a lot of public submissions. There's a lot of interest in health issues. Inadequate committee budget to enable the full committee to participate in study tours. The resolution was that Parliament will be requested for additional funding so that all members could travel for study tours. Committee membership changes threatens continuity and affect institutional memory. The committee will need to advocate Parliament to strengthen procedures to institutional memory and ensure smooth committee operations. Inadequate follow-up on committee recommendations. There's a need to institutionalize a tracking tool for resolutions, commitments, and recommendations so that these are not lost on the wayside, and we keep on adding more recommendations, and the previous recommendations are not actually followed up on. This is just to show the committee budget. That the committee was allocated 3 million, and then yes, it was allocated 3 million. This is just a projection that on a 5% growth at the end of the term of the 7th Parliament, the committee might be allocated 3.6 million. In terms of the human resources, this is the secretariat, the committee secretary, Ms. Machalamba, myself, the content advisor, the researcher, Mr. Rahim, a committee assistant, Ms. Makubane, executive secretary to the chair, Ms. Sotishe, communications officer, Ms. Landu. That's the end of the strategic plan, Chair. I'll leave it there. Thank you.
Yeah, it was a marathon, but you managed. Thank you so much for the presentation. Can I see hands of colleagues who want to talk on the matters? I'll start with Honorable Van Staten. You'll be followed by Honorable Mutawatse. That's the end I'm seeing thus far. I'll check the others as we progress. Then Honorable Sene, Honorable Shabangu, you'll follow each other after the two colleagues. Oh, there's also Honorable Dr. Lerox. Leroux, you are there. Dr. Tape as well, in that order.
Chairperson, thank you very much. I don't have much to say on this. The only thing I have to say is that at least in this term of Parliament, we've got a complete comprehension plan, and I want to move that we adopt it. Thank you, Chair.
Honorable Mutawatse, my apologies.
No, thanks. Thanks very much, Chair, for the opportunity. I don't want to take much of the time, but as the MK Party, we have raised an issue that is very close to the nation, not only to the MK Party. That has to do with indigenous medicine. I think colleagues have received a letter that we have circulated so that we are together when we discuss this whole matter. But our point of departure, Chair, is that the strategic plan is not talking much. It has got some weaknesses in respect of this particular area. One of the things is that there is no defined strategic objective on indigenous medicine. And secondly, there's no program or indicator or target or budget allocation in this respect. And also, we are of the view that this, as it goes, it is in contravention of our own constitution in respect of us providing quality and equality of health care to our people. It is our view that we have not made enough progress in respect of making sure that the traditional healers and the practices are incorporated into the mainstream of health. And therefore, we want to suggest that the issues that we are raising must find expression in our strategic objectives so that we are able to have an oversight on what is happening in that area. Because this matter has a very serious effect on the health system itself. For example, you're having some bogus traditional healers out there who treat patients, and after they treated patients, they are offloaded to the healthcare. But it is our view that if we are to work together and bring them into the main system as required by the Act itself, we will be able to avert some of the challenges that we are having. So we are calling on our staff members, in particular the researcher, to look into this particular issue, and that this particular area find explicit expression in our strategic plan so that we are able to monitor what is happening with the traditional council, because there's a lot that is happening out there. We know that there are fights that are happening in terms of the traditional council, its effectiveness, and how the recognition of traditional healers themselves, because that's part of our responsibility. So I'm calling on the committee to immediately integrate this into our strategic plan, but part of that should be to call on the traditional council in the department to come and make a presentation to this committee so that we now understand where things are, what is it that we need to do to move forward. Thank you, Chairperson.
Thank you, Honorable Mutubatse. Can I allow Dr. Likape to come? He had asked to be recused. I'm trying to check that.
Yes, thank you, Chair. Just a few comments. I accept the issue of the strategic framework and thanks for the report. But I think over the next few months, we probably need to review what the priorities are, because it seems to be all over the place. The second issue is we don't seem to have anywhere where we would engage with the statutory bodies effectively. All of us receive lots of complaints about the conduct of healthcare professionals and care in our institutions. And I think we should make space for an urgent interaction with the statutory bodies in terms of their complaints management, the training they provide, the fact that, you know, the quality of care that people receive is appalling, and that patients are not treated with respect. And lastly, Chair, the issue of health information system. When you look at the issue of liabilities, record keeping is a problem. In this day and age, we should not be missing any records. We lose cases in court because there are no records. Why are we still keeping records on paper when we should be having a health information system with electronic record keeping? I hope that aspect, Chair, we will treat as a priority, because that's going to be key to being able to have a system that works and being able to access information at the tips of our fingers. Thank you, Chair.
Thank you, Dr. Likape. Dr. Leroux? Over to you, Dr. Leroux.
Thank you, Chair. Apologies, my mouse didn't want to work. Chair, thank you. Yes, I would like to second the proposal to accept this strategic plan. I also want to recognise the concerns raised by my honourable colleague, Dr. Miss Honourable Matabatse from MK in terms of the traditional healers. I do think that it is, I'm not quite sure how to incorporate that. I do feel like the approach of the strategic plan that we have has been very general, and we haven't raised our specific issues. I mean, I personally feel very passionate about HIV and TB and malnutrition in children, and that hasn't been specifically raised as an issue. And I think that it is probably appropriate for us to keep it fairly general and to take note of Honourable Matabatse's comments in the context of that. But I wouldn't be comfortable to specifically raise up one issue like that above everything else in terms of the way we do the report. But otherwise, I'm happy with the report, and I would propose that we accept it. Thank you.
Okay. That's the proposal. The two hands, Honorable Sini.
Thank you, Chairperson. I also wanted to appreciate the presentation. It was indeed comprehensive and the true reflection of our discussions. And I also wanted to second, Chair, the adoption of the report with the proposed amendments and additions by honorable members. Thank you very much, Chairperson.
Honorable Shabangu.
Thank you, Chairperson. Let me also join the other members in appreciating this well consolidated strat plan. Chair, I also read was it a letter or just the information from Honorable Mtubatse? And as I was reading through this strat plan, because let me make an example that for the proposal that we made on the strat plan, that we should have a dedicated engagement with the Council for Medical Aid Schemes. But then when I was looking at this, then I realized that when it's captured like strengthening the oversight, the strat plan cannot go into details to specify. I'm hoping, I might be wrong, but I will need to be guided. I was looking at it that when we then start working on the programs, these will be included, including what Mr. Honorable Mtubatse was saying, because I realized that if everything is in details, then we'll be having a very long strat plan. But I believe and I hope that everything will be captured. In so saying, Chairperson, I also want to join others in adopting this report with the amendment or the understanding that the additionals or the additional comments they will be attended into. Otherwise, I also supporting the adoption of the report. Thank you, Chair.
Okay, is this two hands of Dr. Liklape and Dr. Lero legacy hands, or they want to raise further issues?
Chair, I just wanted to raise something further, that we should not forget our responsibility in terms of the health market inquiry. And we probably need to engage the ministry in terms of urgent amendments to the Medical Schemes Act. When we interact with the Section 58 report, what it's going to require is going to require us to urgently review the legislative framework around medical schemes. Thank you, Chair.
Okay, that's another further addition. Dr. Lero?
Sorry, Chair, that was a legacy hand.
That was a legacy hand. I should think there is consensus that we adopt the plan and then there were additional inputs that we can give our content advisor and the researcher to incorporate all those, because whatever I had coming from colleagues was just to enhance the document. And then it's our own document that also then there will gonna be a process for review. So we can therefore, I think the feeling, they will move us in the name of Honorable Van Staden and Dr. Leroux, and they was also supporters in the name of Honorable Sene and Shabangu to say that less than adopt with the proposed amendments, which I believe we have the Secretariat has noted that, and then once those amendments are incorporated, the document will be sent to you. But the view of all of us is that also this must be adopted, and we all know that there is gonna be time for the review. Whatever there's anything that as and when we implement towards the end of the year, then we're given an opportunity to review. Should there be new ideas, new innovation, and whatever we think needs to be done, we can always provide space for that. But I think there's consensus that this must be adopted with all the proposed addition to the document. Yeah, I should think that that's the way forward. And I think I have represented all of you. Thank you so much, colleague. It's heartwarming. to see colleagues working together to make sure that we deliver on our mandate. Do we still have any other agenda item? The minutes, I suppose we are dealing with minutes now. You can guide us in terms of the program, Will?
Yes, Chair, we are adopting the minutes. We'll start with the set of the 5th of November. Thank you, Chair.
Okay, can I ask Honorable Keko, can you lead on this, the acting chair? I was not in the meeting. It will be easier for us to move. Is the minutes of the 5th of November. Page 1 on the attendance. Is that okay? You'll raise a hand if there's issues that you want to deal with. When you are silent, colleagues, I'll assume you are all happy with what is being projected. I will hear a shout if there's anything that colleagues feel is not adequately addressed. Those are the minutes. Any correction, any amendment, Honorable van Staden?
No, Chair, I just want to move for the adoption of the minutes. It looks like to me it's a true reflection. Thank you.
There we go. There's a mover, Honorable Shabangu.
Yes, seconded, Chair. Thank you.
Minutes seconded by Honorable Shabangu. The next set of minutes.
The next set of minutes is the 11th of November, Chair. Thank you.
Next set of minutes, the meeting took place between 18 hours to 19 hours. There's the list, acting chair for the attendance. On page 1, it proceeds to page 2. Then page 3 deals with the opening remarks, the agenda, the presentation by the department, and the resolution and the meeting adjourned at 19 hours. Any correction, inputs on the minutes? I don't see any hands. Then can I get a mover and a seconder? There's Honorable Fisani. Your hand is up. Can I hear you?
Yes, Chair. Thank you. This is a true reflection of the meeting that took place. Therefore, I propose the adoption. Thank you.
Can I get a seconder for the adoption, for the proposal for the adoption of the minutes? I can only see the Honorable Senior on the matter. Can I hear you, Honorable Senior?
Thank you, Chairperson. I'm seconding the adoption of the minutes.
The last set is the minutes of the 12th of November. Thank you, Chair.
Yes, minutes of the 12th of November via virtual platform from 9 hours to 11:56. There is the attendance. I'm just worried about the apologies. Ms. Clark, Honorable Clark is recorded as present, then also on apologies on page 1. Can that be attended to? If it's leaving earlier, that should be minuted as such, because she cannot be present and also absent at the same time. Page 1, if you check page 1. Also on Honorable Zungula, you say Zungula Miss V instead Mr. Will you see what I'm talking about? Vuyo?
Yes, Chair, we will make those amendments.
Okay.
Thank you, Chair.
Then page 2, page 3, it was briefing by SAMRC. Page 4, and then the minutes end at page 5, and we've already also dealt with this report earlier. Can I get a mover and a seconder of the minutes? It's a true reflection of what transpired in that. Honorable Mutubate?
I move, Chair.
There's a mover and the seconder. Honorable Jacob, I think the hand is up. I've noted you, Honorable Sheila Keko, ST. Can you hear me?
No, she's struggling
And
with the
she's muted.
gadgets.
Yeah, finally, she will talk now. I see her microphone is on now. Over to you. No, she's muted. Can I get a seconder? I saw the hand of the other hand there was another hand that was raised.
It was me, Chair.
Honorable Van Staden.
No, I'll second, Chairperson, no problem.
Okay, seconded. Is there any other item according to my agenda that was the last item on the agenda?
Yes, Chair, that was the last item in the agenda. Thank you.
I see the hand of Honorable Keko. You want to raise something? She seemed to be struggling with network, ne? Okay.
Yeah, she's in Eastern Cape.
Yeah. And yeah, okay. Colleagues, I think that brings us to the end of our meeting. And I want to thank you for responding despite the short notice. And then we are full house till we meet again in the next meeting. The Secretariat and the Content Advisor will input on the strike plan and the statutory rate report so that it reflects all your deliberation. And having said that, I want to thank all of you for attending this meeting on a Friday and wish you well for the weekend and the constituency day on Monday. Hope to see you soon in the next meeting. Enjoy your day further and weekend. Till we meet again, the meeting is adjourned. Thank you so much, colleagues.
Thank you, Chair.
Thanks, Chair.